One of the most common questions that women ask their OB-GYN is whether stress increases their risk of miscarriage because, let's be honest, being pregnant is very stressful. And historically, OB-GYNs have not given the most accurate advice on this question. So I'm going to show you some research which may really surprise you. And if you're pregnant or someone you love is pregnant, I hope this can help inform your care. So I want to tell you about a story of a woman I was talking to who had recurrent miscarriages. And she was asking me about whether her levels of stress are going to affect her having another miscarriage. And I really wanted to help her. And I told her what most OB-GYNs do tell their patients, which is don't worry about it. It's mostly beyond your control. Stress has no impact on your miscarriage risk. But I was actually wrong when I looked into this research. So hang with me. I think it's going to surprise you. As I mentioned, most OB-GYNs are not actually up to date on this question. And by the end of this video, you're going to know how off they are and some lessons for those that you love. And what's really going to help you is knowing which parts of pregnancy are at the highest risk for stress to impact the pregnancy. And we'll talk about how cortisol actually does some of these types of mischief. And I'm Dr. Omar. I'm here to help you with evidence-based medical advice. And this is purely educational information, not personalized medical advice. So let's talk about patient beliefs versus what OB-GYNs say. Now, as I mentioned, most OB-GYNs say stress does not increase miscarriage risk. But if you ask patients, most patients think it does. In one study, 76% of women say stress is related to negative pregnancy outcomes. This is also a part of a lot of cultural traditions and a lot of folklore, which is often dismissed. And what I'm about to show you is that there's some truth to what women feel in terms of stress and what folklore has tended to believe. So let's step back here. So remember, what is miscarriage? It's defined variably depending on the textbook and the source, but approximately a loss of pregnancy in less than 23 weeks. 23 weeks is viability when the baby can survive in a hospital or a NICU. And about 20% of pregnancies do end in miscarriage. And now this is for people who are around age 30. So miscarriage is extremely common. It's often not talked about, and there's a lot of shame. And it's important to remember that this is extremely common. The other thing to remember is that this risk of miscarriage does go up as people get older. As women get towards 40, it's about 40% chance of miscarriage, which is a substantial percentage if you think about it. That's a ton of miscarriages. Here's a graph that shows this in a little bit more detail. This is here the age from 15 to 50, and this is the risk of spontaneous abortion, otherwise known as miscarriage. And as you can see here, the lowest rate of miscarriage, looking to be about 15%, 12% is going to be between 20 and 25. And then, as I mentioned before, by the time you get to around 30, you're looking at just under 20%. By the time you're at 40, you're at 40%. And then, of course, by 45 and onwards, it's almost closer to 70, 80%. So these are extremely common things. The other thing to remember, it is true that the most common cause of miscarriage is chromosomal abnormalities, not stress. 70% of the time, if the miscarriage is before 12 weeks, it's going to be chromosomal. And this is what your OB-GYN will probably say. Oh, this is almost all chromosomal. So it's about 70%. It's not all. There's many causes of miscarriage. So that's important to remember. The chromosomal stuff arises because during cell division, when egg and sperm after fertilization are dividing, something zigs rather than zags, something randomly goes this way rather than that way. And you can have some abnormal cells that develop, abnormal chromosome division. And this is not at all from anything that parents have done. It's not to distress, it's not to the environment. So remember that. And then, of course, there's other causes of miscarriage like exposure to alcohol, cigarettes, weight gain, exercise. And with obesity, there's a lot of inflammation as we gain weight that can influence the pregnancy as well. And even too much exercise has been shown to increase risk of miscarriage, especially if it's high intensity. So the first really narrow empirical question to get at this larger question is, are the rates of miscarriage higher among women who are more stressed? If you just look at a bunch of women who say they're more stressed, are they more likely to have a miscarriage? And the answer is yes. So this is the first study we're going to look at. This is an epidemiology study. It's the spontaneous pregnancy loss following economic downturns. So this has been observed by economists for a while now. If you look at a recession or a economic depression, we see more spontaneous pregnancy loss. We see more miscarriage. The second thing that you can see from this other study from the British Journal of Psychiatry is looking at different acute life events and miscarriage. We see pretty stark data when you look at women who have a miscarriage versus women who go on to have a normal labor and delivery, and you ask them, Did you have a severe life event during the 13 weeks before your miscarriage? The women in the miscarriage group were 220% more likely to have had a severe life event during the first 13 weeks of pregnancy. Were you having any major social difficulty during this period? The miscarriage group, 850% more likely. Did you have a life event with more severe short-term threat during the 1 week prior? 1,400% more likely in the miscarriage group to say yes. A life event with severe short-term threat during the 2 weeks before your miscarriage, 950% more likely. Did you have a life event with severe short-term threat during the 3 weeks prior to your miscarriage? 450% more likely. So we see a clustering of acute events before miscarriage, at least in this study. And if you just say, have you experienced any of these stressors before miscarriage? You have about 590% more likely for the group that has miscarriage. So there's something about stressful events and miscarriage that is happening here, and we're not really sure exactly how it works. But these two studies do show that there is a connection. It's not as though women who have miscarriages are equally stressed. That's just not true. So this second or third study is really interesting because what they do is they look at stressful life events in women who have miscarriages or spontaneous abortions, but the chromosomes of the baby is actually normal. So these are not miscarriages due to chromosomal abnormalities. And that's a really interesting population because it can tell you more clearly about non-chromosomal causes of miscarriage. So this study, what they did was they looked at tissue cultures of these fetuses that had died. They actually analyzed them and they categorized them as having chromosomal abnormalities or chromosomal normality. And then they looked at positive and negative events that had occurred 4 to 5 months before this loss. So now we know these fetuses or babies that had chromosomal abnormalities or no chromosomal abnormalities, and then we look at positive and negative events in the 4 to 5 months before the miscarriage. So what we're getting at here, is this a chromosomally normal miscarriage or is it chromosomally abnormal miscarriage? And what we find is that in the chromosomally normal miscarriages, the women were 160% more likely to have had one or more negative life events in the months before the loss. And what that suggests is that if you have a miscarriage with normal chromosomes in the baby, these negative life events may be involved. Now, maybe you're a skeptic here and you say, negative life events shouldn't really have any impact on miscarriage. I just don't believe it. If that was the case, then we shouldn't really see any difference in the likelihood of having a stressful event before the miscarriage of the fetus that's chromosomally normal. There shouldn't be a difference between the normal and the abnormal chromosome fetuses or babies. I hope that makes sense. But we do see a difference in the likelihood of negative events in chromosomally normal pregnancies. And that's interesting. It's a signal. It's not proof, but it's a piece of data that helps us see that there may be a connection between stressful life events and miscarriage when the chromosomes are totally normal. And in the study, they controlled for all the other things that increase the risk of miscarriage, like smoking, caffeine intake, alcohol consumption. So it can't be just that there's a difference in those things. All right. Now, this is a even more important study because it's a meta-analysis. What that means is that it's a study of studies. It took all the past studies on this question and tried to look at whether there was any tendency in those highest quality studies between psychological stress and miscarriage. And this was published in 2017. There's some conflicting past studies which show no difference or no effect of stress. And then there's a bunch of studies that show there is some. So this meta-analysis tried to resolve that. And what did they find? The rate of miscarriage in women with a history of exposure to psychological stress is 42% higher overall if you look at all of these studies. And that's a significant number. 42% is non-trivial. And here again, they controlled for differences in study type, stress exposure, types of control conditions, publication bias. So it's a pretty reliable number here, 42%. Here's another way of looking at that 42%. Here's a bunch of the studies on the left side here. And if there's no difference, if there was no effect here, you would expect this little diamond here to be the same as on the left here on the black line, but we see it's a little bit to the right, which means there's some effect. What's also interesting is that the authors of the study were able to break down some of the different types of causes. So they looked at psychological stress per se, life events, and work stress to see how much each of those things increase the risk of a miscarriage. And what we can see here is that psychological stress increased the risk by about 80%, life events 85%, and work stress 27%. So you have different causes of this overall 42% effect. And again, we see another recurring theme here, which is that major life events maybe are contributing to miscarriage. And work stress is also something that people probably don't think of that could be affecting them. Second question here that's relevant is the risk even higher among women who've had a miscarriage already? So we've looked at the overall rate, but what if you're somebody or you love somebody who has already had a miscarriage and now they're going for a second try? Should they be worried about the amount of stress in their life as something that might contribute to a higher risk of miscarriage when they try again? And again, I wish it wasn't the case, but it looks like the data shows the answer is yes. So this is the first study we're going to look at. It's a prospective study where they looked at how much stress women were experiencing and a correlation with early pregnancy loss, which normally means under 13 weeks. And they're only looking at women who've already had a miscarriage or pregnancy loss. So what did they do? They confirmed that these women were pregnant. They did a beta HCG test. They confirmed that. And they looked for any association between the perceived stress the women were feeling during the time of conception, periconception. And they used daily diaries, questionnaires at the end of every month. And they correlated that with their risk of early pregnancy loss, as well as overall pregnancy loss. So if you look at women in the higher stress group, they had a 69% higher risk of any pregnancy loss. And they had 116% higher risk of any pregnancy loss that was actually detected by beta HCG. So sometimes you have miscarriages that you're not able to detect. Like you can't see the HCG going down. So these are substantial numbers. And again, here they're controlling for all the other things that can confound miscarriage, like age, BMI, employment, marital status, income, education, race, parity, prior losses, exercise, nausea and vomiting symptoms, alcohol, caffeine, smoking. There's all these other things that can contribute to miscarriage risk. So they control for those things as well. So it's a pretty high quality study, and they just focused on the factor of stress. This is another way of looking at that data. So they're looking at total losses here, like any loss, any pregnancy loss, and then a loss that's been documented by beta HCG or a clinically confirmed loss. So as you can see, no matter how you measure this quote unquote loss, you're seeing a significantly higher risk. Now, the third question we can ask is, what's going on here? What's causing these losses? Is it from higher cortisol levels? Cortisol is a stress hormone. And the answer we find is that's probably true. Cortisol is probably one of the mechanisms that explains why stress can lead to pregnancy loss and miscarriage, especially in the early part of pregnancy. Cortisol can do some damage. In this study, they actually looked at women who were less than 5 weeks of gestation. A lot of miscarriages and pregnancy losses or fetal death happens at this early stage, and sometimes women don't even know it. So in this study, it was focused specifically on the first 5 weeks of gestation. And what we see here is that on the left, what you can see is that if a woman has an unsuccessful pregnancy, the cortisol levels are a little bit higher. So the average here is a little bit lower than the average on the right. And then the same thing here, another way of testing cortisol is not just to look at the overall level, but look at what proportion of the peaks during the day had cortisol in them. So when you have an unsuccessful pregnancy, you have a higher proportion of cortisol peaks during the day. So the two ways you're measuring this outcome, both showing the same thing, that successful pregnancies don't have this higher cortisol in the first 5 weeks. That's pretty definitive evidence that there can be a connection between cortisol and miscarriage. The second study goes a little bit further. It's a cohort study in pregnant women, and it's following them over time. And what they did was actually looked at this other hormone called CRH. It's corticotropin releasing hormone. It's a different hormone that's correlated with stress hormones. And what they found is that women with later miscarriage also perceived higher levels of stress. And this was all, again, replicated and correlated with this stress hormone being higher. So that's just another data point that shows this pattern here. So we've seen it with cortisol, we've seen it with just self-report, we've seen it with CRH, this other stress hormone. Number 4, which might be on your mind, is, okay, I see the connection now, I see a possible mechanism, but does the kind of work stress matter? Because I have to go to work, I have to do things in life. So how am I going to survive? Am I just going to stay in bed all day? So if we can try to look for some studies that help identify which types of work are especially damaging, that could be really helpful. So it does matter. The type of work does matter. This is a study of different types of work environments. So shift work, number of working hours, whether the person is lifting heavy objects, whether the woman is standing, and other physical workload, and correlating that with miscarriage. And what did they find? On the left here, you'll see the type of work environment. And then on the right, you're going to see the overall risk in the red box. So for someone who's doing shift work, a woman has about 50% higher chance of miscarriage. Fixed night work, which is another way of saying shift work at night, 65% higher chance of miscarriage. Working hours means working more than 40 hours a week, 33% higher risk. Lifting heavy objects, 11% higher risk. Just standing doesn't really seem to do much. And physical workload is about 12% higher risk. So shift work, probably because when you're in shift work, that's going to mess up your circadian rhythms and your sleep is going to be off. And when your sleep is off, your cortisol is going to be off. And maybe that's what's affecting the pregnancy and the developing baby. Same thing with working longer hours, over 40 hours a week, probably higher cortisol. Lifting, who knows? Maybe that's a mechanical thing. So those are some things to keep in mind. The other thing that this study was good at, it was trying to look at higher quality studies and lower quality studies to see whether maybe this effect is just a result of bad studies. So they divided these studies into their level of quality. And what they did was they took the same types of work variables and they looked at all studies versus better studies. And what you see here is for some of them, it did make a difference. This kind of shift work schedule didn't really change anything. There's still a 12% higher risk of miscarriage. Nighttime work, shift work at night, you still see this huge 51% increase in miscarriage. And then working 40 hours a week, even when you look at really good studies, it's still 17% higher risk of miscarriage with working more than 40 hours a week. Lifting more than 100 kilograms per day, that goes down to 2%. So that was controlled for by better studies. Probably not an issue. And then standing more than 6 hours a day, that seems not really as much of an issue after you control for good studies. So take that for what you may, but overall you see some kind of pattern here, which is that it's not true that any work is okay. Not all work is equally safe for miscarriage. And that's really helpful to know. Another way of coming at this question is thinking about the stress of losing your job. And this study tried to look at whether job loss was connected to risk of miscarriage and stillbirth. And they defined job loss here as whether you lose your own job or your husband or partner also loses a job, which can be very stressful for a family. And what did they find? Very similar. And remember, this is involuntary job loss. It's not like somebody wanted to quit because they hated their job. That doesn't really count. We're talking about involuntary job loss. So you have about 81 to 98% increased risk of miscarriage with involuntary job loss. I think there's something there with the stress of being fired. There's something with the stress of stability, income, routine. There's a lot of ways in which job loss can create stress. So that's something to look for. Maybe consistency in work is really important to think about before getting pregnant, and also the type of work that one is doing to make sure it's not too risky. And then here's another study that specifically looked at surgeons, because surgeons themselves experience a lot of pregnancy complications. And what this study found was that women who are surgeons who are pregnant are more likely to have major pregnancy complications. And this includes things like preterm delivery, uterine growth restriction, infertility, miscarriage. And all these things are higher compared to non-surgeons. And if you look at the actual rate of complications, it's extremely high. So the average obstetric complication rate for surgeons, for female surgeons, is between 25 and 82%. And in the general population, that's 5 to 15%. So you're looking at a 400% increase in obstetric complication rates amongst female surgeons. And why is that the case? Is it because of a connection to the study I cited earlier, where there's certain types of shift work, lack of sleep, stress of being a surgeon, maybe the manual work, the physical work is intense? Because we know certain types of intense exercise can increase miscarriage risk, but if you're a surgeon all day, you're basically doing intense exercise all day. So maybe it's something there. Maybe it's just the stress of dealing with life and death for other people. Maybe it's the hostile work environment. Maybe it's the chronic insomnia. Who knows? There's many pathways here, but I hope this will be studied more so that our female surgeon colleagues can have more supportive environments, maybe different types of policies relating to pregnancy to support them during that time, especially during residency. But this is an interesting finding because it connects to the other findings that we saw. So the question that may be on your mind is why? Like, why is this happening? What's the exact biological mechanism? How is it possible that some nebulous thing like stress can in fact impact something so concrete like a growing baby? So one way to think about this is that the sympathetic nervous system, which is the fight or flight part of your nervous system that gets revved up. This is run by adrenaline, norepinephrine. What happens is when you have that activation of this fight or flight system, which is what happens when you're stressed, something called vasoconstriction happens, which means that your blood vessels constrict, become more tight, and blood pressure goes up. What happens in this situation is that you're going to have less blood flow to the uterus and the placenta, and obviously less oxygen and nutrients going to the developing baby. So that's one possibility of a mechanism of how you can go from stress to miscarriage risk. A second one is that this hormone CRH, corticotropin releasing hormone, we know that this itself, if you just give that to someone, it triggers uterine contractions. It triggers something called prostaglandin to be released more. So independently, we know this mechanism is active. And of course, if CRH is higher, it makes sense that a miscarriage could be more likely. In addition, the actual hormone cortisol itself, if you think of it in terms of just the design of these signals in the body, what does cortisol signal to your body? In terms of evolution or design, cortisol is a sign of perhaps an unfavorable environment because we know when you have short-term cortisol spikes, that's good for the organism generally. Like when you get up in the morning, you have a cortisol spike and that helps you get ready for your day. But chronic stress or extremely intense stress, extremely high cortisol peaks, it could be a signal to the developing baby of an unfavorable environment. And it might be part of the design mechanism to induce miscarriage. Perhaps that's why there's a connection between cortisol and miscarriage. Maybe there's like a conserved mechanism there. And cortisol will disrupt implantation. It'll also inhibit placental development, the development of the placenta, which is a crucial nutrient supply organ, and the immune tolerance of the embryo. So the embryo, as it's developing, is treated like a different immunological entity other than the mom because it is. It has its own DNA, it has its own bodily integrity. So you don't want the mom's immune system attacking the developing baby. So there has to be this fine dance between the mom's immune system and the antigens and the molecules in the developing embryo, fetus, and baby. And what happens with cortisol is that this delicate balance can be disrupted with cortisol going up. So that could be one mechanism by which miscarriage happens. Cortisol also will lower prolactin, which is a hormone, and progesterone, which is another hormone. And these two hormones are needed to maintain an intact pregnancy. So if those hormones go down when cortisol goes up, that can contribute to miscarriage risk. And you may have heard of sometimes OB/GYN doctors will give progesterone to a woman who's had a miscarriage in the past in order to prevent a future miscarriage. And this makes sense. Another pathway is that cortisol will increase insulin and glucose. That's why when you're stressed, your blood sugar goes up. And when you have higher insulin and glucose levels, there's going to be dysregulation of your vascular system, your endothelial system, all these blood vessels, and that can cause dysregulation also for the developing baby in the womb. Another mechanism, cortisol will inhibit the immune system. That's why when you're stressed, you're more likely to get infections. That's why students often get infections right before their exams. It's not because they're trying to just call out sick. It's that stress decreases your immune system function. And that could also be happening here. Maybe the mom is getting more infections and one of these infections causes a higher miscarriage risk. And in general, chronic stress or extreme acute stress can cause more of these high inflammation cytokines, they're called. And it can change some of the way these cytokines are working in the womb. And those are necessary for maintaining the pregnancy over those 9 months, 10 months. So if that gets messed up with the cortisol, that can also contribute to miscarriage. And specifically, the way that happens is complicated, but there's all these characterized mechanisms for programmed cell death, the invasion of the placenta to a certain degree, and so on, which we'll skip over here. The other mechanism by which you can connect stress to miscarriage is just more simple. People respond to stress with dysfunctional behaviors often. If you think about anytime you've done something not so healthy when you were stressed, maybe emotional eating or using substances, pregnant women also sometimes will be more likely to turn to nicotine, cannabis, alcohol, even harder drugs under stress. And those things can also induce miscarriage or increase the risk of miscarriage. So that's another mechanism. And something as simple as sleep loss can also, in fact, affect the way the pregnancy goes. That's one hypothesis. There's not a lot of hard data on that. But also chronic poor diet, malnutrition, especially with all that nausea and vomiting, maybe not eating for weeks and months, electrolytes going off, losing lots of weight in the first 3 months. That can definitely affect not only stress levels, but also the way the developing baby is going to respond to some of those stressors. So what I take from this is that, remember, 70% of miscarriages are actually chromosomal in origin. Don't forget that. But it does go up with each year of age. By the time somebody's 40, they're about 40% risk of miscarriage from chromosomal abnormalities. But the common wisdom amongst OB-GYNs is actually wrong. Stress is an additional risk factor. And from what we've seen from these studies, it has a impact of about increasing the risk of miscarriage by 42% from the meta-analysis that we saw. This primarily is going to impact the first trimester of pregnancy. So if you can get past that first trimester, maybe week 13, 14, the impact of stress is not going to be as dangerous. And this can possibly be happening by the direct effects of cortisol on the body, this dysfunctional response to stress, perhaps with certain dysfunctional behaviors, and psychological stress itself, as well as acute life events. So think about job stress, general psychological stress, acute life events, really intense, tragic moments. We talked about work stress. We talked about different types of work stress. All of those things come together. And I think if you yourself are pregnant or you love someone who's pregnant, care about someone, I think it's important to think about this, to try to protect that person. And certainly with things like overnight shifts, working 80 hours a week, it's just common sense, right? How is that going to be good for anyone, much less a woman who's very vulnerable during the first 3 or 4 months of pregnancy? And surprisingly, if a woman has had a miscarriage already, she's at an even higher risk of a miscarriage again. And she's at an even higher risk of stress impacting and increasing her risk of another miscarriage. So the impact of stress is even more important for a woman who's already had a miscarriage. I think that's really important to remember for us to take care of ourselves, take care of each other. And I think also we need to raise awareness about this, and we need to help people make more informed decisions after they find out they're pregnant. Those first couple of months after you find out you're pregnant are really important, as opposed to just saying, oh, that baby's, you can't even really see it for 4 or 5 months. My stomach's not going to really get big. Let's just think about this later. In fact, those first 3 to 4 months may be the most sensitive time for stress. In addition, I do think we should change our policies to be more sensitive to the stressors that women face in the first 4 to 5 months of pregnancy. Typically in our society, at least in America, parental leave policies are focused more on when the baby arrives. But I think we should have parental leave kick in, especially for the first 3 months of pregnancy, or maybe even for all of pregnancy, given this data that we've seen here. Or at least there should be a discussion about these kind of things to provide more support. Just think of how much heartache can be prevented, how many lives could be saved if we change some of these policies so that people were more aware of the importance of caregiving, self-care, other care, environmental care, work care, and avoiding these types of toxic stress in the first 4 months of pregnancy. We're not even at a point where these policies could change because this is not even widely known. People don't really know this yet. Thanks so much. I really hope this has been informative for you and those you love. If you've enjoyed this, check out this other video and feel free to join my newsletter. It's free. Take care.